Your Medicare broker is supposed to work for you. They're supposed to serve as your liaison, so it's absolutely imperative that you work with someone that you can trust. And while most Medicare agents and brokers are honorable in their intentions and actions, there are some that are less than scrupulous. And that's why it's very important that you are informed and aware of what to be on the lookout for as far as any red flags are concerned. So first and foremost, how are Medicare agents and brokers paid? Well, many agents and brokers advertise that their services are free, there's no charge to their clients. And automatically when people hear free, they start to become suspicious. But it is actually true. You do not have to pay a Medicare agent or broker for their services because they are paid by the health insurance carrier, which is the insurance company, in commissions. But different types of plans offer different commissions. So does that mean that your insurance broker or agent is steering you towards the highest commission plan? Well, not necessarily. For example, something like Plan G might pay a larger commission. However, Plan G is one of the most popular Medicare supplement plans because it offers the best coverage to new enrollees. So it really is one of the best Medicare supplement plans available to new enrollees, and that's really the reason why many agents or brokers will steer their clients towards Plan G as opposed to possibly that higher commission. Now, as we discuss in other videos, Plan G will cover almost all of your out-of-pocket expenses. And because of this, it does tend to have higher monthly premiums when compared to other Medigap plans. So it's very important that you run the numbers to make sure that the premium that you're able to access for Plan G is really in your best interest. It's also important that you compare Plan G to Plan N because that's really sort of the most similar plan available, and possibly even a high deductible version of Plan G. A good broker will happily compare and contrast these plans as well as discussing the varying price points. Now let's switch gears and talk about Medicare Advantage. Now, Medicare Advantage gets a pretty bad rep, and that's despite the fact that most people, actually over 50% of Medicare beneficiaries, are actually enrolled in a Medicare Advantage plan. And not only are Medicare Advantage plans marketed much more heavily than Medicare Supplement plans, but they also pay much higher commissions. And there are pros and cons. Medigap plans, aka Medicare Supplement plans, will sometimes impose an out-of-pocket maximum, like in the cases of Plans K and Plan L, although many of the plans really don't need an out-of-pocket maximum because so many of the out-of-pocket costs are covered. Medicare Advantage plans will always impose an out-of-pocket maximum. For Medicare Supplement plans, there may be medical underwriting depending upon when you enroll and what state you live in. With Medicare Advantage plan, there is no medical underwriting ever. With Medicare Supplement plans, the costs, i.e. the benefits, are standardized, so Plan G will remain the same Plan G regardless of who your carrier is. And that's not the case with Medicare Advantage plans, although they often will offer lower deductibles, copays, and coinsurance when compared directly with original Medicare. Now, no additional benefits are offered by Medicare Supplement plans. They're really just a financial solution to cover those deductibles and copays and coinsurance. On the flip side, Medicare Advantage plans very often do offer additional benefits like dental, vision, hearing, prescription drugs, and many more. Medigap plans, there are no referrals, so you can go to see any specialist without need for a referral, and there is no pre-authorization. That is, of course, not the case with Medicare Advantage plans. If you have an HMO, you'll definitely need referrals, and there's always that issue of pre-authorization, which is a very big issue. And finally, with Medigap plans, it works regardless of who your carrier is. If your doctor accepts original Medicare, they accept your Medicare Supplement plan. And unfortunately, with Medicare Advantage plans, not only are there networks, but those networks can be extremely restrictive. Sometimes you'll hear people say that Medicare Advantage plans are really just for when you're healthy. And the truth of the matter is, very often that can be the case. However, it's not so easy to just switch to a Medigap plan in most states at most times in your life. So if you're thinking more long-term, which we highly advise you to do, more often than not, it's advisable to enroll in a Medicare Supplement plan. However, of course, there are some exceptions. For example, if you live in Florida, Medicare Advantage plans tend to be a cut above the rest when you're comparing to the rest of the United States. Also, there are some states that have much more flexible Medigap enrollment. And if that's the case, then you could potentially enroll in a Medicare Advantage plan now. Generally speaking, they are less expensive, more on that in just a minute, and then maybe switch to a Medicare Supplement plan at a later date. Again, this is not advisable in most states. In most states, you can really only enroll in a Medicare Supplement plan in that 6-month window after you turn 65 and enroll in Part B without medical underwriting. Should you choose to enroll after after that, then you may be subject to medical underwriting, which means you could be charged more or denied outright. A good agent or broker should thoroughly discuss the pros and cons of Medicare Advantage, as well as go over the health systems and hospitals in your area that might accept your plan. They also are going to need to talk to you about Medicare Supplement enrollment should you decide that later down the line you do in fact want to switch. Because again, as I said, if you are subject to medical underwriting, which is the case in most states, although not all, then it can be very, very difficult to switch to a Medicare Supplement plan, if not flat out impossible. Now, like with Medicare Supplement Plan, Plan G, just because Medicare Advantage plans pay a higher commission, that's not necessarily the reason that your agent is recommending them. So we've already discussed some of the reasons, but there are other reasons as well why you might want to look into a Medicare Advantage plan. Chiefly that they're just much less expensive. For many, especially if you're living on a fixed income after retirement, it's just not financially feasible to pay for your Medicare Part B monthly premiums and a Medicare Supplement Plan, which can be much more expensive when compared to Medicare Advantage plans. In fact, many Medicare Advantage plans are offered at no additional charge. Many Medicare Advantage plans are a $0 monthly premium. We do not say free because you still need to pay for Part B. But again, that's much lower than having to pay for Part B plus a Medicare Supplement Plan monthly premium. So if finances are a major concern, then your agent may guide you towards a Medicare Advantage plan. Of course, in an ideal world where money is not a factor, we would probably likely recommend that you enroll in one of the higher coverage Medicare Supplement plans plus Part D, because later down the line, if your health needs do become more extensive, then a Medicare Supplement plan is going to offer you much more flexibility and much more coverage when compared to Medicare Advantage. But while we're talking about finances, if you're eligible for Medicaid in addition to Medicare, then your agent or broker might guide you towards a Medicare Advantage plan because of D-SNPs. D-SNPs are dual eligibility special needs plans. They're a type of Medicare Advantage plan that is only available to those who are eligible for Medicaid and Medicare. And with a D-SNP, you'll have access to the full benefits of Medicare, plus Medicaid, and many more benefits as well. So those can be a great and cost-saving option. Now, just like with anything else, if you feel pressured, if you feel like your agent or broker isn't taking the time to really discuss these Medicare Advantage plans thoroughly, then that's a red flag. Speaking of agents and brokers, you should know the difference. So an agent is a representative of the carrier, that's the health insurance company. So they can really only present you with options that are covered and offered by their employer. A broker, on the other hand, works for you as opposed to the insurance carrier, and they can serve as a liaison between you and the insurance carrier. They're able to present you with a variety of different plans offered by a variety of different carriers. Now, that's not to say that an agent of the carrier doesn't have good intentions or isn't trying to suit your needs. They may just be a little bit more limited than a broker. Something that's also very important to discuss is that original Medicare and Medicare supplement plans do not cover prescription drugs. Many Medicare Advantage plans offer prescription drug coverage, which is one of the reasons they can be so appealing. But if you're going with original Medicare and a Medicare supplement plan, you are going to need Part D as well. Now, Part D plans are actually extremely complicated, and they're usually pretty darn inexpensive, especially when compared to the other parts of Medicare, and they usually pay a very low commission, if any commission at all. So sometimes brokers aren't even interested in helping you to enroll in a Part D plan, and that is a big red flag. Your broker or agent should be there to assist you in all matters of enrollment. Your broker or agent should be able to help you. Even further down the line, if our clients have questions, they're able to call so that we can provide guidance and steer them in the right direction. Now, if you have questions about your health insurance, Medicare, or anything health insurance related, you can reach us in the comments below or at the number on the screen. We are licensed health insurance brokers, and we're licensed nationwide. And as I mentioned before, there's no charge for our services because we are paid via commission. Now, one of the best ways to protect yourself is really to stay informed. So please make sure to subscribe to stay up to date. And of course, please make sure to like this video so that we can get this information out there. All right, let's get back to it. So let's talk about Medigap for just a moment. Now, I'm loath to say that a health insurance broker or agent would really steer you towards Medigap if it's not in your best interest, because number one, very often Medigap really just is in your best interest. Medigap plans, Medicare supplement plans, will offer you the ultimate flexibility and way more coverage really when compared with a Medicare Advantage plan. Also, Medigap plans, even when combined with Part D, tend to pay much lower commission than Medicare Advantage plans. So really, it's not in the agent's best interest to guide you towards a Medicare Supplement Plan unless that aligns with your interests as well. The only thing I could say is that benefits with Medicare supplement plans are standardized and they're not going to change year over year. So basically, once you're enrolled in a plan, unless you live in one of those states where switching plans is easier, once you're enrolled in that plan, you're pretty much staying in that plan. You don't need to reassess the plan every year because switching to another plan is likely not an option. So I guess it could be easier for a broker once you are enrolled, but again, I don't really think that that is the dominant influence at play here. But again, if you ever feel pressured or rushed, that's a big red flag. One of the best ways to protect yourself is just to stay informed. So I'd highly recommend you check out this video over here to learn more about Medicare, and of course make sure to check out our Medicare playlist. Of course, if you have questions, you can reach us in the comments below or at the number on the screen, and please, please, please make sure to like and subscribe. We'll see you next time.